Hi, everyone. Welcome and thanks for joining today. I am Regan. If you're new to the channel, I am a small business owner, an entrepreneur, and a corporate housing operator. So glad that you're here to get some education on some of these different topics, and hopefully you learn a lot. Today, I am absolutely delighted to be joined by my friend Brian Lee, who I met over, let me think about this. It's actually close to 15 years, but not quite there yet, maybe 12, 13, 14 years ago now. And we got to know each other when I was in a different industry. It was kind of the second chapter of my career when I spent 10 years in healthcare IT, and had the amazing pleasure of getting to know folks like Brian involved in rural healthcare specifically, and look forward to having him share his story here with you. Thanks, Brian. Welcome.
Great to be here. Great to see you again, Reagan.
Well, it definitely has been a while. I know I took you by surprise, but at the same time, as I was sharing just over the last few minutes, you've had more of an impact on me than you realized. You share a lot of wisdom along the way, not just with your clients and those that you serve in that way, but with the kind of strategic partners that you work with, and that's what's I think really interesting is that, I've never been a client, I've never worked for you, I've worked alongside you, serving a lot of the same audience a long time ago, but I did learn so much from you, and seeing the following that you've continued to grow over that time, and even since we were last in touch. And I just think that the work you do is so powerful. So first, I just want to say that I really appreciate that, and I know that countless people in healthcare that have no idea that you exist actually have a better experience because of the work that you and your team do in healthcare. So, for those that don't know Brian, I want to share just a little bit and let him share his story and kind of how it overlaps with what I'm doing today. And so, Brian, if you wouldn't mind just sharing with everyone kind of your calling, your personal
You
mission, what
bet.
you're working on, and how you serve people.
Well, as a calling, we make a difference in the lives of people who make a difference in the lives of people, and that's healthcare.
Hmm.
And as a our organization, Custom Learning Systems, our vision is kindness care everywhere. It's shifting cultures of healthcare organizations from job-driven, task-driven, financially driven to showing up and being in the moment for the patient. The way we manifest that is enabling our partners to achieve five-star distinction, five-star recognition in the way they deliver their care to the patient. Because which does the patient better understand? The clinical treatment or personal experience? Is their personal experience. Which do corporate investor housing clients better understand? The physical environment or how they interact with you and how easy you make it for them to utilize your corporate product or service. So we work with rural hospitals and federally qualified community health centers. These are clinic networks that serve the poor. So the commonality is we work with organizations that serve the underserved. And they're entitled to a five-star experience, regardless of age, regardless of gender, regardless of financial status, regardless of anything. Every human being has the right to a compassionate, empathetic, non-judgmental experience. Now, I know that's a different perspective from your clients, but let me see if I can link that. So we sign a 3-year engagement with an organization. And during that 3 years, in a nutshell, we send a very gifted trainer on site for 8 days. We assign an executive coach who's been a former hospital CEO on an ongoing basis. We provide them with 3 software programs, and we hold an amazing annual conference called the Healthcare Service Excellence Conference, which we just held in Galveston 2 weeks ago. 500 plus folks attended. The conference was rated a 4.97 out of 5.0. Let me see if I
Wow.
can link that to what you're doing. That is, your clients are your, investor partners asking their customers to rate what they do.
Mhm.
Feedback, as Ken Blanchard said, is the breakfast of champions. And so the foundation of five-star experience anywhere, anyhow, is using customer feedback to continuously improve.
Mhm.
Ben Franklin said, that which is painful instructs. So it's not the nice stuff, it's the ugly stuff that's valuable. I've been doing this for 41 years. I figured out at the beginning of my career that I should ask for feedback. I spent the first 2 years ignoring the nasty, ugly stuff and just focused on the nice stuff. But I reached a point where I wasn't getting any better. So I started paying and being obsessed with what my customers said that they didn't like about me. And it was a long, slow journey. And I remember doing a speaking tour in New Zealand and Australia for a month. Took my mother with me. I spoke a couple dozen times, but I spent hours and hours and hours poring over the evaluation forms
Hmm.
to find out qualitatively what they didn't like. Now, yeah, you want to do more of what works and a whole lot less of what doesn't work. So I think being obsessed with the customer, being obsessed with their perspective, and don't think because you talk to your customers that you know what they think.
Mm-hmm.
Because why won't most people bother to complain about food in a restaurant? Because they're afraid that there'll be a new invisible moist crust coming back on the way back from the kitchen. So, um, survey customer experience survey literacy is very important. And in healthcare, it's everything.
Mm-hmm.
Because in healthcare, why, I ask this to doctors all the time, been doctors 20, 30, 40 years. How many times does a patient ever say they didn't like you? Well, once or twice. No, it's never. They never do that. But is it possible they tell the rest of the world? Absolutely. Is it possible they go on social media? Absolutely. So the difference between also rans in any
Mm-hmm.
industry and high performers is they're obsessed with continuous improvement.
So
Good,
true.
better, best. Never let it rest till your good is better and your better is best. And so when we work with our clients, if they don't have a good survey vendor, we require them to get a survey vendor and not inhale your own smoke. And the problem is with many organizations, and I can just go on and on and on about this, they'll tell me that they'll show me the data from their internal survey showing that they're 90, 95%.
Mm-hmm.
And then I see the verbatim comments from people that are livid with them, and I see their Google ratings, and I see livid with them, and I read RateMD, I read all those other things, and there's not 95%. So the question is your survey giving you data that will enable you to get better? Because if all it's telling you is you're great, you're wasting your time. So I see endless overlaps between the corporate investor real estate industry where you can't make mistakes, and if you do make mistakes, the only way you can get around them is work your way out of them, and the way you work your way out of them is satisfying somebody along the way.
So true. I mean, the overlaps, there's no doubt. It's 100% there. And I guess one of the things that I see is not only the importance of that and the feedback. I mean, there's no question, but the way that you and your team, you kind of go behind all of that. You talk to the people in the different departments. You find out what little rifts are going on internally that could be creating issues. And it's like you just kind of have a way of deconstructing that to get to the root of the problem. And like you said, continuous improvement. I mean, that is exactly what it is.
We like to make it real clear, learn one new idea every day and do it in a better way, which means you need to be good at listening. And there's many ways to listen. You can ask people, what's one thing we can do better? You can ask people smart questions like, what would prevent you from recommending us? You can ask if there's one thing that would change the way you see us, what would it be? You can ask them. You can survey them. You can look at your data, look at your numbers. Why aren't the numbers improving? I think that entrepreneurs who are brilliant at what they do are brilliant at reading the customer. The way I like to say this is, if you will listen to your customer, they will teach you everything you need to know about how to get them and keep them for life. Before getting into this, I was a sales trainer. I've written manuals on how to sell cars. I've written manuals on how to sell insurance. I've written manuals on how to sell timeshare. Timeshare. Uh, I've written manuals. We call it, by a variety of names. I like to my favorite is sell with ease. And and if you're going to be successful at selling, You sell by listening, not by talking. And if you're going to be successful at selling real estate, or even creating relationships where buyers that nobody else will sellers that no one else will sell to you, it goes down to relationships. And the way we like to say this is relationships first, business second. Now, in our world, we say relationships first, clinical second. In relationships first, but create a relationship first. And it doesn't take forever to create a relationship. In fact, how long does it take? I like to tell the story. I went for a checkup at the local hospital, and the tech came out to greet me, and her name was Tatiana. He said, "Are you Mr. Lee?" I said, "Yep." She says, "Follow me." She was having a miserable day. She was not happy with her life. And I'm sitting in her cubicle, and I said, "May I ask your name?" She said, "Tatiana." I said, "Tatiana, Privyet." Now, if you're Russian, you'll know that means hello. She says, "Privyet, how do you know that?" I said, "I went to Russia." "Where'd you go?" "I went to Moscow, Siberia, and St. Petersburg." "St. Petersburg? I'm from St. Petersburg." I said, "You're kidding. Have you been to Petergoff Castle?" "I live 6 blocks from there." So this woman had no interest in me and was treating me as a transaction.
Mhm.
Before I left, she said, "By the way, you got to come back tomorrow to drop off the equipment. Instead of spending 12 bucks, let me tell you where there's a secret parking stall that you can use." Relationships first, business second. Regan, that's what you're about. Relationships first. We had a great relationship. We lost touch, but that still doesn't change the fact that when you called me, of course I'm going to respond because I enjoyed our relationship. And isn't that true in everything?
So true.
Where isn't it true? Want to maintain a relationship with an insurance company that is renting an ongoing basis for you? Uh, Maintain it. Know the people, know something about them. Um, we are teaching, we run a sales training program now for healthcare, believe it or not, called the Swing Bed Growth Academy. So in rural America, the way rural hospitals sustain themselves is they do rehab
Mhm.
for discharges from urban hospitals. But nobody in healthcare has ever been taught how to sell. And our average client grows their census by 3. Well, it says 3, 3, what's that mean? Fill 3 more beds a day, 365 days a year. That's worth $2 million in gross revenue. And then the bottom line is, since you're there already, guess what? So we teach people how to prospect. We teach them how to create relationships. What we don't teach them is 12 tricky ways to close a sale. Because if you create a relationship and provide a meaningful, worthwhile service, you don't need try 9 tricky ways to close a sale. Healthcare professionals are totally opposed to knowing anything about selling. My definition of selling is helping people make decisions that are good for them. That's it.
Wow.
If you're not helping people make decisions that are good for them, and they don't have a need, and they can't afford it, why waste your time? Move on. Get on to the next one.
Well, I was
No,
definitely
look.
surprised when you said sales. I'm like, "Now how is that?"
Yep. Making decisions that are good for them. And the fact is that the difference between two hospitals 30 miles away, one is successful, wasn't in, one wasn't, is volume. You got to fill the beds. You got to be busy. Very expensive to run a hospital. For every patient, you need 10 employees. Now, people get outraged. Why do they need so many employees? Well, when you break it down, you realize you need them. You gotta provide a safe, caring environment. So I see that there's very much an overlap between customer experience, sales success, sustaining sales. Now, it's an old cliche. It costs 5 times as much to get a customer as it does to keep one. But man, is that ever meaningful cliche. Because I know what it cost me to get a client for 3 years, and the
Mhm.
price you pay when you lose one because you didn't do a good job. And I'll tell you where most organizations fall down. Most, I was a politician for 9 years. I was on city council for 5 years. I knew every developer in city, and every developer wanted to know me. Funny how that works. And I want to go back to um, relationships and selling. That uh, you need to always be continuously improving and running as fast as you can to get better And then the way I like to say there's a better way to do it. I want to do it yesterday. Isn't that true in any field?
So true. Yeah.
Yeah. Yeah.
Well, I think you're right. I mean, there's no question there's significant overlaps, and I think service excellence in any business is, you know, too often overlooked. And I think, in healthcare, and I think what you and your team have done is an amazing job of kind of deconstructing the experience and, figuring out where some of those places are where that improvement can happen. But, I think the other thing that carries across industries is very much just the role that culture and leadership can play within any organization, and just creating that culture of people wanting to do a good job and never ever getting hung up in the "it's not my job," type scenario, and really just, as you said, the relationships and caring about the end client. And that very much does carry across with what we do when we think about, the households in transition that we're serving, that we're helping to house. Either, they've had a fire or a flood in their home. In many cases, they might be relocating from overseas. They could be working, on a project as a travel medical professional or as a construction crew, and, not familiar with the area. And even things like if they are coming from another country, the plugs are different. There's so many little things that are different, but that concept of service excellence, I mean, there's just no substitute for caring and no substitute for hospitality, both in housing and in healthcare.
Well, you've touched upon a vital subject in this whole thing. It's called culture. And our mantra is change your culture or be doomed to repeat the past, because culture runs the organization. Culture is what employees do when no one is looking. Culture is that white spot in the org chart, that nebulous thing. And if I survey an audience, I say, how many are involved in culture change? Usually 90% of the hands go up. But how do you change culture? Oh yeah, we're involved in culture change. Well, what are you doing? Well, when you find out about it, it's rearranging the chairs on the deck of the Titanic. You change culture by changing behaviors. And that change of behaviors, the byproduct is culture change. You don't have culture change for the sake of it. So if you want your people to embrace a customer-driven culture, you got to get your frontline in a classroom to learn what good service means. You can't hold your employees accountable for what they don't know. And I would guess that 90% of the people listening today that have employees are not doing any skills training for their employees. Now, what we do at Custom Learning now is we have what is called a license to please. And we've identified 7 skills, 7 ideas, 7 best practices, so that transfer ownership from leadership to the front line. So the missing ingredient is most organizations have a mission statement, check, a vision statement, check, a set of values, check. But values don't equate to behavior. Values are nice, warm, touchy-feely things. But unless you're extraordinarily obsessed with making values real, it doesn't change any behavior. Skills do. Skills do. And it seems to me that one of the most valuable skills that your listeners could embrace for their front line is service recovery.
Ah,
And the
so
way we
true.
teach that is the complaint golden rule that when you mess up, you fess up and dress up. Now, most of your listeners are reluctant to trust their front line to decide how to dress up because they're afraid they'll make a mistake.
Mm-hmm.
And they don't trust them. And most of the listeners' employees won't do service recovery because they don't want to risk making a mistake, because they don't feel trusted, and they don't want to risk their job. But service recovery is the game changer. It's what is necessary, because where are managers when you need them? Nowhere. Well, if you're unhappy with service, when do you want that problem fixed? Yesterday. You
Yeah.
want it now. You want it by the person you're dealing with.
That kind of takes me back to kind of when I first met you and, was in healthcare. And I can now remember some of the parallels at the time because, I was much earlier in my career at that time, but somehow or another, I remember it coming up the concept of empowerment that I learned at an early age. I was fortunate enough to do an internship with Disney when I was in
Right,
college.
right.
And, they teach you day one when you're in orientation, they call it traditions or did back then
Yes,
anyway,
yes.
and talking about this concept of feeling empowered to do what you need to do, feeling supported by the organization to do that. And you're 100% right that service recovery is number one, not easy to teach. And, especially in healthcare. I mean, my goodness, do I understand there's a lot of complexity to, people feeling confident in maybe replying how they might want to reply to any given situation. There's all kinds of legal repercussions, there's privacy repercussions, there's a lot of things, but at the end of the day, it goes back to what you said. It's how you make people feel. It's that relationship and just showing compassion, for people in a hospital by definition are usually not there for any kind of a good reason. And so, that certainly makes it a taller order to begin with. But I think that when any frontline employee, and I think a big part of what I learned from day one with you and your organization is really understanding the vital place of frontline employees. A lot of the most powerful things don't happen at the executive level, they happen in day to day interactions with the people that you serve.
Amen. Amen.
And that
No,
service recovery piece, I think, so often when something goes wrong and you get it back on track, sometimes that's where you have some of those best opportunities for loyalty because people recognize, things are not going to always go according to plan, but just being willing to take accountability and to right the ship, I think people appreciate that and value that.
well, in our day-to-day world, about 5% of what we do doesn't work. Mistakes, errors, things don't work. People show up
Hmm.
late. People have and people have bad attitudes.
Hmm.
Attitude is everything. Um, and only about 20% of employees have an innate attitude of being winners. We say there's 5 types of attitudes. Superstars, about 3% of the workforce. They'll always rise, regardless of where they are. Winners, about 20%. They come early, they stay late, they want to get ahead. They have a fabulous attitude. The middle group, about 50%, we call grinners. They're for paycheck. They can go either way. They can either influence by the winners or that takes us to the whiners. About 25% of the workforce are negative. It's in their DNA. They grew up with a belief system for whatever reason that is negative and hostile. And they can be coached, but if they can't be coached, you got to support them to get on with life some other place. And then the last group we affectionately call slugs. And these people have nothing to offer. Whatever happened with their life, I'm sorry about it, but they ain't going to change because of you or anybody. And you got to support them to get on with their life some other place. We say find a competitor that has a signing bonus, drive them over and help them apply, but get them out of your place. So I wonder if your listeners are paying attention to the culture and the attitude of the people that work for you because it is a mirror of the owner.
Well, you kind of read my mind there a little bit because as I think about everything we're talking about here and, where the commonality is between service excellence in healthcare, service excellence in housing, or really any other industry for that matter. One of the things I recognize about you and your business is, and correct me if I'm wrong, I know it certainly used to be this way, probably more often than not, when you get brought in by an organization, it's not because they're setting records with great service right now. It's because something has gone maybe horribly wrong or, what have you. That's puts you behind the eight ball from the very beginning because you're having to really pull people up by the bootstraps to get things turned around and to get a culture going. And that is not easy work. So I'm curious what advice you would have for entrepreneurs, for owners of all different types of businesses that, I think every business probably goes through some cycles of struggling with culture for whatever reason. What's some of the advice that you would have for for someone that might recognize their business is struggling with a culture issue, to kind of get things going in
Well,
the right direction.
it's like if you're a husband and you want to know how to start working with your relationship, ask your wife. That won't take long. Go check in with your frontline employees. Now, there's several ways to do that. We have found that, yes, employee engagement surveys, doing them on an ongoing basis is very important. But when you get the report, do something about it. Very rarely does anybody do anything except do nice PowerPoints to say we should all ought to be doing this. But what we have found invaluable is to do a frontline focus group. So when we go into an organization, we do a focus group with frontline, we do a focus group with clinical leaders, we do a focus group with non-clinical leaders, we do a focus group with providers, and we meet with the board. So before we do anything, we meet with them. But ask your frontline for guidance and advice. Now, it can't be, if you're the CEO, it can't be you.
Right.
But make sure in that room are only frontline, nobody that has anybody reporting them. And there's 3 questions you want to ask them. What works best here? Start off on a positive note. Now, by the way, they won't want to waste any time because when you ask them what works, they'll want to talk about what they're not happy about. But
Right.
stick to the subject. What works best here? Second question, ask them if you were the CEO, could wave a magic wand, what would be 3 things you'd change to improve the patient experience, employee engagement, or communication? Now, you didn't have to say all those things. If you just said, what are 3 things that make this place better? Whatever they talk about, let them talk as long as they want. And if someone wants to jump in it, let them jump in. If somebody wants to jump in, and slowly work your way around the room. Now, it's good to go armed with some additional questions, but I'm just saying there's 3 questions you got to ask.
Hmm.
Listen. That's why it's valuable to have an outsider do it, because they have objectivity and people will share with them.
Oh yeah.
And the third question at the end is, what do you need to do to make this a better place? Now, I'll tell you why we asked that third question is so it's not doesn't turn into a bitch session. Now, bitch session is a Canadian term, so just so you know. I know Americans don't use it, but we use it all the time. But don't let it degenerate into oh me, poor me. So the third question is, okay, what do you need to do to make this a better place? Because by that time, after people have listened to each other and talked about it, they're starting to dawn on them that, geez, I could do better, right?
Hmm.
So I just think that if you want to take the temperature of your organization, surveys are useful, but having this and have them verbatim comments and go and asking them, one of the things we do when we do a frontline focus group is we ask them, what can you tell me? What is your knowledge of these 7 skills we teach? When we do a focus group with clinical leaders, we ask them, of 10 key best practices, how would they rate their doing, for example, bedside report? And when we meet with non-clinical leaders, we'll ask them, what do you think are the education needs for your frontline? Well, they'll tell you what they're thinking about. So again, I just want to say I'm a huge believer in real-time interaction with frontline staff. If you're an investor and you want to go that route, I got another idea for you. Have birthday breakfast once a month. If you got 200 people, divide by 12, invite them all to breakfast. And the agenda is you tell them what's going on and you ask them what's going on. In a positive environment like that where you're connecting. That's an easy thing to do and you'll be surprised what you learn. But if you want to know what's wrong with the organization, ask the people who deliver the service and then do something about it.
That's really good advice. I mean, I think that could apply across so many industries. And I
Totally.
just love, nobody knows it like you and your team. You guys really, I mean, I'm thankful to have had the opportunity to, have been alongside you on a few visits. And I greatly appreciate that. But it is so amazing what you learn when, you go to different people in different areas of the organization. And it's funny how you hear about the same problems, but from a different perspective. And it certainly doesn't make it easy. And you're right, that piece of, the front line, the clinicians, the executive team, the board, and eventually kind of construct all of that back together and try to get to the root of what's going on and what needs to happen. So, in any case, I'm so thankful. I think that the concept of service excellence is something that carries across all industries, and I think it impacts everyone, in different ways. Everything that we do as consumers and as users of healthcare, and when you see opportunities for improvement, I know I certainly see things differently today when I have any kind of healthcare experience or am receiving really any sort of service. And of course, a lot of times you see things where there's an opportunity for improvement, but you also see those superstars, like you mentioned, those people. It's almost like going on an undercover boss sometimes, right? Like you see those people,
It is almost, yes. Yeah.
yeah, like they really shine and they just carry the place. And you're like, maybe everything's not perfect, but thank you. Well, it's amazing. Thank you for sharing some of your expertise today. Brian, if people, and actually, interestingly enough, there are a number of folks within my real estate investor community that are in healthcare that are just investing, for a variety of reasons, getting depreciation and things like that. If someone wanted to reach out to you or find you or Custom Learning Systems online, where would be the best way to find you?
Well, they can email me at brian@customlearning.com. Brian, Brian @customlearning.com. And if anybody wants to email me and request a copy of my book, Satisfaction Guaranteed, I'll send you a digital copy. Uh, you'll find it a very valuable read. Just don't read it late at night if you're tired and have to drive. But think of that as a little gift for suffering through this interview with me, trying to make what we do relevant to you, what you do. But I'd love to share that book because I think you'll find it useful and 100% relevant.
Amazing. Well, thank you so much. Thanks again for joining. Thank you, everyone in the audience, for joining. And hopefully, you found some great content and will join us again.